I'm very proud to be a member of the health system. As part of the health system, we can take advantage of consultations and administrative support throughout the system, and I can get advice and consultations from my colleagues. And as part of the system, we can practice state-of-the-art cutting-edge radiology, which is terrific.
It means to be part of a system which, through bold steps taken by its leadership over the past 20 years, has positioned itself to be a strong player in the future of healthcare in the New York area and even the tri-state area.
Well, it's really a great pleasure and an honor to be associated and work for a system that's on the cutting edge of providing healthcare in our region. Every day I get to experience the innovation and dedication of many members of this organization, and it's professionally very satisfying.
Being a physician at the North Shore-LIJ health system means that there's a better support structure for better patient care. Connecting with other physicians across the health system means that patients will be better taken care of.
I think it's extremely important for us to connect as physicians across the health system. We're all dealing with similar issues: healthcare reform, accountability, payer demands, and together we can look at each other's solutions to the many problems and challenges that we face.
Coming from a small community hospital where we frequently require the need to transfer our patients, it's important to have a very understanding relationship with many of the physicians across the board, OBGYN and surgery, neurosurgery, a lot of the subspecialties. So it's extremely important for us to connect and to know each other so that we can have that working relationship.
The most recent memorable moment for me was with a medical student who actually was here for about 6 weeks recently and told me that after being here for 6 weeks that this rotation changed their mind and they wanted to go into family medicine, which means a lot to me. And they were sincere about it and have since applied to the program that we run.
More on the right side or left side? Left side.
Well, last year I had the opportunity to attend as the guest of honor of the 100th birthday party of a patient who I've been caring for since I started practice almost 40 years ago. That was a great experience to see her still totally functional, enjoying herself and appreciative of the care she had received. Although I can't take credit for her age. I think someone upstairs was more responsible for that than I.
In the next 5 years, I'd like to see North Shore LIJ Health System solidify their footprints across the region.
Well, I'd like to continue to see the growth and development of a premier institution that's able to deliver a level of care that's commensurate with what it is that we do in 2013 and beyond. Clearly, as we've gone through the decades, medicine has evolved and changed, and it continues to evolve and change. From bringing in the newest technology to the newest medications to the newest types of surgery is important. But I also think the avenue of caring, the avenue of respect, the avenue of service delivery to the patients is paramount also. And I think both sides of the equation, the scientific side and the humanistic side, need to continue to be fostered and continue to grow.
The pendulum has swung back a bit. I think it's truly an exciting place to be. Technology is doing remarkable things in medicine. And medicine, I now have kids who are in college and contemplating various degrees, and it's an applied degree. It's a degree you can get a job in. And it's also a place where you can combine whatever your interest is to some specialty of medicine. And you can take that field of medicine and work with it in different ways. You may be more on the academic side, you may be more on the research side, you may be more on the clinical side, you may be more on the advocacy side, you may be more on the legislative side, but you can do something with your degree that's meaningful, whether it's direct patient care, whether it's treating global populations, or whether it's advocating for changes in healthcare and healthcare reform. I think it's a fantastic opportunity and a wonderful profession.
You need to know that every day that you take care of patients, you will have the chance to utilize all of your assets, all of your abilities. And as Sir William Osler said, you will have the opportunity to exercise both your head and your heart. I can't imagine a more fulfilling profession.
And so if you want to make your career and provide the best care for your patients, you're going to be pretty confident that you're going to get that as a member of this team.